And thank you so much for joining on a Sunday as well. I'm well, right now based out of Dubai as the training manager for Middle East Africa at Cochlear. And today I'm here to talk to you about this very, very interesting topic. We've called it From Diagnosis to Fitting, the how and why of cochlear implants. So to get started, what we expect would be the learning outcomes for you at the end of this webinar is to explain what is a cochlear implant and how it works, to describe the benefits and considerations when considering a cochlear implant, to identify the role of the professionals in a multidisciplinary team, and explain the selection process involved in the candidate pathway. This is a brief overview of the agenda which we will cover. So let's start off with a brief history. Now, Professor Graeme in 1967 was the first one to start thinking and creating a vision to make an implantable device that will enable the deaf to hear. In 1978, Rod Saunders was the first person to receive a multi-channel cochlear implant. And after this, in 1981, Cochlear was established, and we were able to have the first commercial implant implanted in Graeme in 1982. And he was the first person in the world to receive a commercial multi-channel cochlear implant. Now with this, Cochlear was established, you see, in 1982. And from then, our mission has been to help people empower, to transform the way they understand and treat hearing loss, to innovate and bring to market a range of implantable hearing solutions that deliver a lifetime of hearing outcomes. And as you see here today, I'm hoping that I can help transform the way you all understand and treat hearing loss. Now let's first understand, why should we choose a cochlear implant? When we look at the statistics by the WHO report in 2017, it's found that there are more than 460 million people globally who have a disabling hearing loss. And out of this, there are more than 15 million who could benefit from a cochlear or a bone conduction implant. And less than 5% is our market penetration for these implantable hearing solutions. So you see that out of the global demand for or the need for hearing solutions, we have less than 5% of the market who are actually using cochlear implants. So there's a huge potential to increase the awareness, to increase the access, and increase the number of professionals who are working with cochlear implants. So before we dive in deeper, it's important to understand, why do we need a cochlear implant? What are these benefits which a cochlear implant provides? Cochlear implants provide immense benefits in adults and pediatric population. And if you look globally, different markets in different countries have different spread of this. So if you look at the Middle East region, there is more pediatric population, but if you look at some countries like Australia or America, you may see there's a more significant adult population. But in general, cochlear implants provide benefits for both. It provides significantly better hearing. And when you look at adults, it provides drastic improvements in their quality of life, psychosocial benefits. So for example, someone who, an elderly person who's maybe sitting at home and because of hearing loss is isolated, can go into depression. All these aspects can be avoided. It helps them be more confident to do their daily routine activities, to go to the shop, to go to the store, to go buy their groceries, to watch television and enjoy television, to talk on the phone with their loved ones. And if you look at an age group like 40 to 50 years, where employment is still important, in these groups, sometimes hearing loss can really drastically affect their employment opportunities. Again, a cochlear implant can really help transform the way they hear and bring them back to their best potential in their workplace. If you look at elderly, we all know that hearing loss is associated with cognitive decline, so definitely having the best hearing through cochlear implants can prevent cognitive decline as well. When you look at children, it provides significantly better hearing. And especially if you look at congenitally hearing impaired children, this enables them to have normal language development. And we can very easily see someone who's implanted early and with all the other things right, that child at say age 5 years will be exactly near normal and talking like another 5-year-old child. And that's our expectation. this child will be at 15 going to school, or high school. This child can go become a lawyer, an engineer, an audiologist, a speech pathologist, anything they want, and be just as any other human being and any other child. This enables educational benefits. It provides them the confidence to hear well in quiet and noise. So whether it's the noisy playground, whether it's the restaurant and the cafes as they grow up. So it provides immense quality of life improvements and psychosocial benefits. And these benefits which cochlear implants provide enables anyone using a cochlear implant to live a life like they had normal hearing. And that's our main aim, to bring it as close as possible to this. So let's understand what is a cochlear implant. So we'll see a short video now to understand how a cochlear implant system works, and then I'll briefly take you through it.
So, implant system is designed to provide you access to the sound you're missing. Sound travels to your ear and the sound processor, which sits off the ear. The microphones on the sound processor pick up sounds, and the processor converts them into digital information. This information is transferred to the implant just under the skin. The implant sends digital sound signals down the electrode into the cochlea. The hearing nerve fibers in the cochlea pick up the signals and send them to the brain, which is translated as the sound you hear. Unlike a hearing aid that simply amplifies sound, cochlear implants send sound to the signals and send them to the brain, which is translated as the sound you hear. Unlike a hearing aid that simply amplifies sound, cochlear implants send sound directly to the hearing nerve and on to the brain.
So to quickly summarize, as you all saw, the main parts in a cochlear implant system are the external speech processor, which picks up the sound from the environment through the microphones, processes it in the processing unit outside. There is a battery attached outside as well, which provides the power because there's no battery inside in the internal implant. This information is then transmitted via radio frequency through the external coil to the internal coil, which is part of this internal implant. And this internal implant is what is surgically implanted by an ENT surgeon. This internal implant has an electrode array, which, as you see, goes into the cochlea to directly stimulate the nerve fibers. Now, what's the most important difference between a hearing aid and a cochlear implant? And this is very important to understand to answer the question, why cochlear implants and why not hearing aids? It's important to understand the kind of patients we're dealing with. We're looking at people who have a more high degree of hearing loss and those who are not getting benefit with hearing aids. And these people most commonly have some kind of damage to their outer hair cells, inner hair cells, either they're missing or damaged. So the point and the aim of a cochlear implant and the reason why it works so well in this population is because it bypasses these damaged structures and directly provides stimulation to the hearing nerve fibers. So we now start stimulating the auditory pathway directly from the structures which are healthy and working well. So we do not need to use the functionally damaged cells to try and maximize their potential. We don't need to use damaged structures because we know if a structure is not working to its best potential, it cannot work well even with an amplified sound. So also cochlear implants have shown to provide much better amplification and much better hearing, especially in the higher frequency region, where sometimes hearing aids offer limited or no gains. So these are the reasons which make cochlear implants or a cochlear implant recipient hear everything, hear very, very soft sound without any problem. So even if you talk in a whisper, this person who was previously profound deaf can now hear you. So remember, this is just hearing. So like that aided audiogram should show you good aided audiogram at 25 to 30 dB. But this is not understanding because that needs therapy. Now, when we look into a general implant system, in general, you see that there is an internal implant which is surgically implanted by the surgeon. There is an external sound processor, like I explained, which has microphones. So there are two microphones which have dual microphone technology, which is important for giving clear sound. And then this is the cord which transmits through the radio frequency to the internal implant. Also, this is what is worn by the patient, and it's important to know for the audiologist, we have different fitting software. So for example, this is a screen from the software. This is from the software, which is custom sound. This is a wireless pod, so this is for cable-free fitting. So this connection here, this wireless pod provides a communication between the software and the processor so that the child can easily run around and play during the fitting session as well. And you see this interoperative remote, this one is used in the OR, and this helps us do intraoperative neural response telemetry measurements wirelessly in the theater as well. Now let's look into the pre-implant assessment and candidacy considerations. First of all, as a professional, our main responsibility is to ensure newborn hearing screening protocols are established in our respective countries and regions. This provides a very, very important baseline for having a good cochlear implant program and good cochlear implant outcomes. We need to ensure that you're doing early identification of the hearing status using a battery of tests. We know it's important to use behavioral and electrophysiological tests and provide early and effective intervention. We need to recognize that 30 to 40% of children with a hearing loss can also have additional difficulties. It could be something like blindness. We know there are syndromes which are associated. It could be cognitive. So it's very, very important to have a transdisciplinary evaluation to get all the baseline information. Now, our responsibility once the diagnosis has been done is to ensure that there is all day and everyday use of appropriately fit hearing aids and customized ear modes. It's important that the hearing technology is always coupled with good diagnostic habilitation and follow-up. So there has to be a habilitation along with the hearing aid use, and this has to be diagnostic in nature. What do we mean? Mean that the therapist is constantly evaluating that is the child able to hear well, is he getting good benefit from the hearing aid, or do we need to move to a cochlear implant? In the end, it's just important as a professional for you to ensure you are the responsible for the outcomes for your patient, and it's important for you to ensure that your patient is getting the best treatment option which is available to him. Another important point is to think that when you're counseling your family for hearing aids and you fit the hearing aids, it's important if you think that in the future they may need a cochlear implant to start discussing that option earlier on in the pathway. Not waiting till you're checking that there is no benefit from hearing aids and then going on to tell them about cochlear implants. It's something you can bring about much earlier in the discussion, just so that they have more time to be prepared in case hearing aids don't give them the benefits they need. Now, when you look at the transdisciplinary or the multidisciplinary approach, this is very, very important for the candidacy assessment of a cochlear implant candidate. The main cochlear implant team completely revolves around the patient and the family. They are the center of the team. The cochlear implant surgeon is key because he's the one who's going to perform the procedure to put the internal implant in the cochlea. The audiologist is important to conduct all the audiological and vestibular evaluations which are required as part of pre-candidacy and as well as post-cochlear implant follow-up. A speech and language therapist is also important from the pre-candidacy phase to diagnose whether the hearing aid they're using is effective and what is the best treatment approach. A social worker at this point, if available, is good to collate the information from all the professionals and interact with the family. Some hospitals and clinics which I've worked with, I've seen have a team coordinator or a CI coordinator. And that's very useful because they are the ones who can follow up that all the evaluations are done and to follow up with the family and ensure they're on track to make the decision as soon as possible. If needed, for example, the family needs a counselor, there could be a counselor available, a psychologist may be necessary to do additional tests for the child. It's important to include the teacher of the deaf or someone from the school environment to understand the rehabilitation options for the child, and other neurological and other professionals like the pediatrician, neuropsychologist, and radiologist are also important. In general, this is all the professionals which are involved, but sometimes there are some professionals which are more dominant, and in some setups there are all professionals are not available. So it's the selection which is done on a case-to-case basis. Now let's look at what is the recipient pathway for getting a cochlear implant. The first step is getting the